welcome everybody who's here so far. Welcome everybody else at the end. Thanks for joining us. The Triple ID Conversations are a response to a survey we did last year of membership. And one of the things people really wanted was community. They wanted to get together. They wanted to see other information designers, to hear what's going on. And so the first Thursday of every month, we're going to be doing these. We did 2 or 3 earlier in the summer as part of the summer school, and they went really well. And so now we're off and up and running. And next month it's Carlos Rosa from Lisbon, and he's talking about his entry to the Triple ID Awards 2020, which was on moving pictograms, which was really interesting. And then in December, we've got Rupesh VS from, well, he's originally from India, but he works in Aalto University in Helsinki now. He hasn't given me his title yet. And then January, we've got Rodrigo Ramirez from Chile talking about, I think he's either talking about his pictograms work, or he may be talking about his emergency escape maps, which is Claudine's topic too. So we'll get titles from these people. We've got a few organized now up till January and further. And if any of you want to suggest a talk, that would be great. So these are quite relatively short talks, but it's going to be about 20 minutes today, I think. And then we'll really go into discussion and ask Will some questions and just get a chat going. So I'd like to, very pleased to introduce Will Stahl-Timmins. He's known to some of you who've been to the summer school, I think in 2018, I think it was, or was it 2019? He said a project there which got published in the BMJ. So Will is a data graphics designer. He's trained as a graphic designer, but he did a PhD in a medical school, at Exeter Medical School, looking at information graphics in assessing health technologies. Very, very interesting PhD, which I was the examiner of, wasn't I, Will? I seem to remember that's where we met. And he now works with the BMJ, a leading medical journal, representing information design in that very exacting forum where it has to be right. So I'm really pleased he's going to talk about his work now to us. So Will, do you want to share? Just to say, we're recording and chat is on. So if you've got questions, please put them into chat and we'll try and pick up later. So Will, Will also wants me to explain that somebody in near his house has cut through his internet cable, and he's actually having to log on via his phone connection, a 4G phone connection. But we tested it just now and it seemed to be fine. But if it all goes wrong, I've got his slides and I can start, he can get on his phone and we'll get through this. So Will, share your screen and over to you.
Thank you, Rob. Yes, fingers crossed for that 4G connection. If I disappear quickly, that might be that I've run out of data. I don't think I should with 5 gigabytes left, but you know, we'll work it out. And I hope you can all hear me clearly enough. Also, thank you very much for having your cameras on. It's really great to have a bit of feedback. I can see if you're looking puzzled now and try and adjust what I'm saying or speak more slowly or more clearly or something. So that's brilliant. If you could keep those on, that's great. And yes, questions in the chat or questions afterwards are fine too. Right, I'll share my slides now. I can find them. Right, can we see this okay?
Yeah,
perfect. Brilliant. All right, I'll begin. I've always loved visual communication. When I was growing up, I had 4 much older brothers who were all artists or designers. So naturally, I went to art school. It's just kind of what you did in my family. And I studied graphic design, which I absolutely loved. I think, though, my tutors always knew there was something a bit odd about me. I remember I had a sketchbook and I filled it with pages and pages of this massive complex diagram of all the different transitions I'd need for an interactive piece I was working on. I'm sure that my tutors took one look at it and thought, what on earth are we going to do with all of this? So yes, when all the other graduates went on to do glamorous things in advertising and corporate identity, as Rob said, I went to Exeter Medical School and studied for a PhD. And I learned about medical research and systematic reviews, meta-analyses, and thought for a long time about how to present all of this data visually. And I found that there was this whole world called data visualization or infographics, and people were taking data, representing it with visual elements like shape, size, and color. Finally, the Fibonacci-loving designer had found a home. And I now work for the British Medical Journal, the BMJ. It's a publication that has been around since 1840. It's an international general medical journal, and it publishes not only medical research, but also educational content and journalism as well. Of course, we're now an online first journal, but we do still publish a print edition weekly, and it's delivered every week to all members of the British Medical Association, direct to their home address, lands on their doorstep on a Saturday morning, and this is what happens to it. It sits in a pile in the loo, unopened. This is a known phenomenon that we call the pile of guilt. They do mean to get to this, but they don't. And it turns out that medical professionals are quite busy. They're, working long hours, saving people's lives, particularly when there's a pandemic around. So I can understand why it's hard to find time to keep up to date. And perhaps it's not surprising when our published content looks a bit like this. It's well-researched content. It's potentially even useful to people, but it is potentially hard to access and takes time. So I think that my job is to start telling medical professionals less, but better. So this is the same, based on the same paper, but it's much more engaging and memorable if you can see something about the information and interact with it and sort of scroll through the text. And it doesn't really take that long to make something like this. I mean, this did take me a little while, but compared to the amount of effort that people put into medical research, years and years of, getting the funding proposal together to doing the research and getting it written up and going around all sorts of different journals, it's a small amount of effort on the end to make it into something that looks like this rather than the one before. So we use these kind of things for our educational content. We've tried to transform it to make graphics that can encapsulate and store knowledge and allow you to refer to it when you need it. This is a sort of way that you can triangulate on a diagnosis by looking at lots of different dimensions and see which things fit a particular condition. Obviously, I'm showing you all the flashy ones, but the vast majority of what we do are static kind of one-page diagrams like these for the education section. And there's something kind of honest about having a static representation, because it's almost like a contract. You know how much time it's going to take you to read something because it's there in front of you, and it's a manageable chunk. And these work well in our print journal, but they also work really well on social media, because you can just share the whole thing rather than having to click through like you do with an interactive graphic. And also we know that doctors like to cut them out and keep them in their filing cabinets. This is one that a doctor sent me of their drawer of BMJ infographics from a while ago. So educational content was one we cracked relatively early, but it was a bit more difficult coming to the research content. We now publish these little kind of 1000 by 1000 pixel square, what we call visual abstracts, which they summarize the design, the population, and the results of research papers. And I guess the purpose is really to let people have an introduction and know quickly if they need to read the full paper and if that's relevant to them. We started making these in 2018, and we now publish one a month. Of the 13 to 14 research papers we publish a month, one of them has a visual abstract. That's what we have resource for at the moment. There's just me and a couple of freelancers that work on the infographics at the BMJ. So yeah, it's quite tricky to decide what to do for best. For the journalism content, it's kind of a mix, either really quick reactive content that has to be quite simple if it's attached to like a news story or a topical opinion piece. And then there's these kind of longer term pieces for features and investigations. Like this one was one we did when we published a sort of timeline of the first 2 years of the COVID-19 pandemic. And it was spread over the bottom half of 4 pages in print, and then we had an interactive version of this online as well. And it shows the kind of different lockdown strategies in the 4 home nations in the UK. So you have England, Wales, Scotland, and Northern Ireland are the four rows of the diagram. And then each of these little circles is one thing happening, like lockdown in schools or shops being open again or whatever. And it just sort of shows the differences between the 4 different countries. And then the little bubbles in the background show you the number of people in hospital with COVID-19 at any time, and the colors of the different waves. So the blue is the native type, and the pink is predominantly alpha, and then delta and omicron coming through at the end there. What else do we do? So this is another bit which happens in the education section, but it's also kind of relevant to the research section. This is our Rapid Recommendations project, which is a collaboration with the Magic Foundation, which is based in Norway, and they do rapid systematic reviews in sort of 6 months or sometimes a bit longer than that of a particular new question, and then we produce a big interactive graphic that goes right at the top of the article and contains the main recommendations that they make. They're sort of practical recommendations based on the systematic review. And this is the one from our COVID-19 treatments piece. So on the left there, and it sort of features maybe about 20 different drugs that you can use for COVID-19 for people of different severities of COVID, and whether we recommend them or not. There's a few that we recommend strongly and a few that we sort of recommend in certain situations, and then the others just don't work and potentially cause more harm than good. And we've kind of largely automated the production of these now. The graphic on the left I make mostly by hand. The one on the right is almost entirely automated, and this is kind of you can click on each of the drugs on below the diagram to the left, and you get a sort of detailed view of the recommendation and every different outcome, like what the effect on mortality is, what the effect on, what side effects there might be, and it sort of shows you or how strong the evidence is and what the recommendations are specifically for that drug. And you have things like individual considerations like values and preferences that you might feed into that as well. And as I say, we've largely automated that now, partly in response to actually making this graphic, because we've updated it maybe 12 times, I think, over the course of the last couple of years, because obviously new information comes to light, and we realized that in that situation, we had to make it automated rather than doing it by hand, which we did before. And then you can see lots of other infographics that we make here at bmj.com/infographics. If you'd like to look at our visual abstracts, just Google visual abstracts and it's the top result. I'm quite pleased about that. And then, yeah, they do really well on social media. So to put these in context, our median tweet with no infographic last month had about 6,000 impressions and 86 engagements. So you can see that the numbers we're getting with infographics are much higher than that. I mean, obviously I've cherry picked the most widely shared one, although I do need to update this because we published an even better one last month about long COVID. But regularly, I would say we get about twice the number of impressions as the median tweet, and maybe about 8 times as many engagements, and that's kind of a baseline, and some are much higher than that. So they are definitely accessed a lot more than most of our other content on social media. And we've even branched out to data sculpture. So this is a piece that we commissioned for the NHS's 70th birthday in collaboration with some artists from Goldsmiths College in London. And we made these kind of marble runs to explain the amount of money that the NHS spends on average on different ages of people. So there were 7 different marble runs for different age groups, and they were sort of all made with bits of medical equipment like speculums and syringes and test tubes and things. So in the sort of early ones, when you're very, very young or a teenager, it takes just a few seconds to go through. And then by the time you get to the 90+ group, it takes 2 minutes for your marble to run through there. They had the marble sort of stopping and starting and doing all sorts of different things. So that was a really interesting project to be involved with. So that's about 10 minutes. I thought I'd spend maybe another 5 just talking about how we make a particular graphic, and as one example, so I should step you through the stages. And I'm going to be talking here about a particularly challenging and time-intensive graphic that we made during the pandemic. And it started really when we were approached by members of the UK's Scientific Advisory Group for Emergencies, SAGE, and they wanted us to show this diagram that they'd sent us about how COVID is transferred between people, sometimes through the air, sometimes through droplets that land on surfaces. And they wanted us to sort of quantify that and show how much it was important in different dimensions of that, and what you could do to try and reduce the risk of transmission. So I started where I normally start, which is with a pencil and paper. Well, and right, this is a tablet and stylus, but the same principle applies. And I think it's the quickest way of getting down ideas and sharing them, and that allows us to discuss. And we explored initially different ways that we might represent the transfer of disease between two people. We thought about maybe using the width of arrows on the top left there. We thought about using like number of objects flying across the screen, little droplets or something. But the front runner quickly became a color scale, mainly because we didn't really want people fixated on the exact numbers. The information we were going to be working with was relatively uncertain, so we wanted something that just showed an impression of the transmission rates. And then that also allowed us to add in these kind of little pink objects here, which are kind of gates that obstruct the flow for things like, wearing a mask, or, ventilating the room or something like that, to sort of prevent the flows, which I thought was quite a natural way of doing it. So we developed that idea a little further and it came up with this. And actually, we started doing a little bit of testing at this stage. We don't always get the chance to test stuff as much as we should at the BMJ, because timelines are so short, and we're so resource constrained by this. But our collaborators at Cambridge University were really good and offered to take this and show it to some people, and that was really useful. At this stage, wasn't the most amount of information that we got, but we did kind of understand a little bit more about how people would interact with the piece and what they would be expecting from it, I suppose. Like, rather than actual specific changes in this case, it was more just about finding out what people thought they would be able to do with it, which was useful in itself. So after that, I started a sort of rendered version. And so this is not interactive at this stage. It's just something I've worked up in Illustrator to try and make it look like I wanted it to look. And give us a starting point for the interactive tool. And it's not too far from the final one. We have like a set of drop-down menus at the top there that allow you to select different scenarios. So like, are you in a small or a big room? Are you staying quiet or talking loudly or singing? And then these kind of circular buttons to turn on and off masks and visors and things like that to sort of help prevent the flows. And then after getting towards May now, so we started in December 2020, and now we're on to May. There's quite a big time jump there, because the research team was collecting data in that time, and the way that they did it was that they asked 27 international experts to estimate what they thought each of the flows would be, and what evidence that was based on, and then and how certain they were with that. And that gave us every value that we needed for the diagram. So that's many, many thousands of data points. And once I had that data, we could then bring that together. I sort of took an SVG version of that thing I'd worked up in Illustrator, put that into D3, added in the data as well, spent a while sort of coding that all together, and booted up a first kind of real data version of the graphic, which took about 8 months to get to. And booted it up expectantly, found out what I would see, and what I saw was this. It just looked totally kind of washed out, but it's okay. I realized that this is the silent scenario. So that's what you'd expect, right? Silent. So that's fine. It's not the biggest scenario. I set it all to the maximum value in the data set. So it should be fine once I change that. Change it to coughing. And this is what I saw. They're still really washed out. So this person on the right is fully 100% pink, what I was expecting. And so is this node here. But it splits in 3 to begin with. And they all started looking really washed out until you join back up right at the other side. It all just looks really like it's fine. So that isn't exactly what we were hoping for. We tried lots of different ways around it. This is it using a log scale. I always find log scales a bit hard to deal with and a bit harder to understand. Also, the bright white color really wasn't working. So that didn't quite work. And also, yeah, even silent, you've got quite a big pathway at the top. So yeah, a bit of an odd one. In the end, we kind of added this nasty dark purple color to the top end of the scale, and then quite a swift transition from white to pink at the bottom end of the scale, which allowed us to, show the sort of fine detail on the lower end of the scale, but also the kind of range at the top end of the scale, and that seemed to work okay. So we solved that one eventually. Then we added these kind of gates to show to obstruct the flow. It was basically we put little icons on each one, and you could click an icon to turn on the gate, stopping the flow or barrier. And the masks were a little bit awkward to get right, so we had this kind of combination of a drop-down menu and a button. And then you'll notice there's little blue icons with eyes on them. They're throughout the diagram, and they're to show the kind of values behind the visualization and the level of uncertainty behind them. It's like an extra layer of detail for people who are more invested in understanding the nuts and bolts of it. So when you're clicking on one of those, something pops up that we dubbed the geek interface, which shows kind of every pathway that's related to that particular item and the values and the uncertainty behind it. Originally, we were hoping to give people a feature that they could actually adjust those sliders, so they could change every value in the diagram to see, what if our experts are wrong? What if I think it's like this? But we found that in the end that might be problematic, because someone might change the values a load and then pick a screenshot of the resulting graphic and share that, and it would be with BMJ branding, and then they would be able to kind of support an unfounded argument with it, and people wouldn't go and check the source. So we decided that risk was a bit too great, particularly compared with the small number of people who would actually benefit from having this, so we didn't make that feature. At this point, we had a mostly functional graphic, so we did our main tranche of testing. And again, we went back to the Cambridge Research Centre and asked 6 people with a different range of backgrounds to sit down with the graphic and talk through their experiences using it. We made a number of changes based on that. This was really useful feedback. So firstly, we had these 3 kind of zones in the background, an orange infected person, an aqua susceptible person, and the environment in the middle. But no one really noticed it, and it was kind of a level of complexity that we didn't need, so we stripped that out. What else did we do? Almost everyone was confused by this 2-step drop-down menu with a button and a drop-down. People tried to change the mask type and assumed that it would be selected straight away as they'd changed it. So in the end, what we did was we stripped out all of those circular buttons and all of the icons and changed them all into drop-down menus, and then added no mask as one of the items in the drop-down menu for the masks. So it was kind of visually less appealing that way, but we felt that the usability was more important than the visual aesthetics. And it had another benefit, actually, which was that drop-down menus can be selected with a keyboard quite easily, so I didn't have to spend a lot of time working on the keyboard behaviors. I feel that our graphics could be a lot more accessible, but we do at least try and do a kind of basic level of allowing keyboard users to do it, choosing accessible colors and things. So that kind of gave another benefit, which was good. And then the last major change was vastly reducing the size of the intro. So I took it down from 9 separate steps to 3. People were really losing interest and not needing that much information. And I think we kind of underestimated our audience in a sense, because we were aiming this a little bit maybe wider than our normal audience of just doctors, because there's such public interest in the subject. I perhaps was trying to dumb it down a little bit too much, and I think we underestimated people's level of knowledge. Actually, a lot of people were quite didn't need as much handholding as we thought. So finally published it in December 2021. So that's more than a full year since our first conversations about it. So it was a really, really kind of involved project. There it is in the hero slot on the website. And it did well. It did well in the press. We got some coverage from the major newspapers who kind of were, actually, I was quite impressed. This is a tabloid newspaper that took it here, and they actually took the trouble of going in and choosing different scenarios and publishing screenshots of it with different scenarios, and it actually did quite a good write-up of it. I was quite impressed. Did well on social media, and had about 100,000 page views in the first month of publication, and it dropped off quite swiftly after that. So it was definitely kind of a flash in the pan type of thing. Like some of our graphics have been used a lot through the pandemic, like our risk calculators for COVID tests and things like that have had long steady traffic, but this was very much a kind of big splash, not as long a tail as some of the others. So, this is probably one of the most involved graphics, if not the most involved graphic I ever made, maybe with the exception of the marble runs. And it's certainly the longest timeline though, because that was a lot longer. Normally, I guess an interactive graphic would take us 1 to 2 months maximum, but I guess it gives you an idea of what goes into making our interactives when we can. And still a lot of the steps are very much the same. So there was a little video there of it being used and people turning stuff on and off. Here we go. So that's putting a surgical mask on and a visor or no mask. And then that's changing the talking to singing as your scenario, or exercising, or good old coughing. Yes, that's my favorite. Put a cloth mask on, helps a lot. Even a cloth mask, but the other mask a lot better. And then you can change it from a small room to a large room, or go outdoors preferably. Very good. Your way of protecting yourself. So, useful to use different situations. And this is how the geek interface ended up at the end as well. A couple of geek interfaces. Cool, I'll leave it there. So that's me pretty much up on my time. It's about 20 minutes. I just thought I'd leave 3 discussion topics in your mind that are things that I kind of still battle with that might be useful to discuss. But I'm really happy to be led by whatever you guys would like to talk about next. The 3 things I thought of that might be interesting about selection. So I mentioned that we do 1 visual abstract a month out of 12 to 14 papers. I don't know if we get that decision right. We'd love to be able to make more, and we are working on that. But how do we select what gets a graphic and what doesn't? It's the same for our education and journalism. There's only one of me and a tiny budget. How do we make the right calls about that? I've always find that tricky, and a lot of it's about education of our editors as well. They're great, but I could definitely do a better job of that, I'm sure. And then we have 60 other journals that we publish. How do we begin to start dealing with that? Archiving as well. So a flash graphic made 10 years ago, of course, wouldn't be accessible now, and probably the same is true of my infographics. And that's not so bad for our news content that's related to a particular time frame and has a shelf life. But as a scientific journal of record, it's a little bit more concerning about, can people access this information in the future? And we do, with those rapid recommendation graphics, we do publish like a PDF version of them that's like 28 pages long and has everything expanded as a fallback, but it's not exactly elegant to use, not nearly as good as the interactive. And then lastly, publishing platforms. So I'm always struggling with this. Every article that we publish goes to a system called Highwire, which then sends it out to all of the indexing sites like PubMed and all of the repositories. The trouble is, which is great, the trouble is that it only deals with text and images and can't have anything interactive with it at all. We're working on decoupling our website from Highwire so that we can have like 2 versions of an article, one that goes out and one that stays with us, and we can do more things with it. But that has its own problems, because then you've got 2 different versions. And what do we send to Highwire? And it's all a little bit tricky to think through. So yeah, that's it. As I say, I'm happy to take any other questions that you have, but those were 3 things I thought that I struggle with that might be interesting to discuss, but very happy if you'd like to talk about anything else. That's me.
Well, I'm just looking for the thing we can put clapping up on the screen, but I can't find it. Do you want to stop sharing now? Because
I'll imagine it.
There you go. That was really great. Thank you so much.
You're welcome.
We haven't
technology held out.
Questions yet. We've got question from Yatin's made just an editorial suggestion, I guess. Claudine, can we pick your question about the interactive graphic would have been a great tool for the CDC? What's that?
CDC is the United
Centers
States
for Disease and Control.
Yeah, which is a hot mess. If you ever, the mask wearing became so politicized here. CDC was just a disaster, the loss of trust. And I was just wondering if you ever find places where your work actually gets kicked up into, I don't know in the UK, but where it's a government, they can use these tools to educate the public where it just doesn't stay with the publication. Have you ever got that opportunity?
Yeah, I mean, it's one of our things that we track is when some of our work or papers get held up in the Houses of Parliament, and inform a debate there or something. So it's definitely something that we track. I do remember that there was one of our graphics during COVID that did end up in a government report, and yeah, people were quite happy about that, because obviously, you know, influence is one of the things that we seek to have, one of our reasons to be. But in terms of actually having it then used by the wider public, it is a little tricky, because our publication system and our target is doctors, and the language that we use is appropriate for that, and the kind of infrastructure we have is appropriate for that. So we've tried making patient information leaflets a couple of times, and I think I still would like to do more of that work, but we aren't set up very well to be able to test and refine them and do that kind of work. It's not kind of our main core values. So it's you know, it's been a difficult challenge getting to the point where we can do that, I suppose. Does that answer the question?
It struck me, Will, that the work you showed, it seems to be really, really important work. It's just brilliant. You're getting this, you're putting the stuff in a state that doctors can absorb very quickly, but you're just totally under-resourced. You know, compared with the editorial resources which the BMG has. And you say there was it 60 other journals? Did I hear that right?
Mm-hmm.
And
yes, we published 60 journals.
60 journals, and the publishing
BMJ is our flagship.
Yeah. But and then the publishing platforms don't really accept what you've done. So you're in this. I remember in the one of the early issues of Information Design Journal in the late 1970s, Albert Biederman, who was one of the very early infographics guys back then, talked about discrimination between graphics and text, and how graphics were systematically discriminated against by publishers and publishing platforms, in spite of the fact they were much easier for readers to use. Haven't got any further in 50 years, have we? Whatever it's been.
It is strange, isn't it, that tyranny? And it doesn't happen straight away. Like when we teach kids, first of all, we teach them about drawing and how valuable it is. Yeah. But then, you know, later on, the text just becomes dominant. Yeah. Maybe because it's harder. I don't know. It sort of feels like it's more intellectual or something, like kind of go up the spectrum. But I don't know why that should be.
No, you're absolutely right. I just remember my son growing up, schoolwork had a lot of graphics in it until the age of maybe 12 or 13. When the only thing you did that was graphic, I suppose there's a bit in geography, but art. But up to then, all the different subjects, they do drawing and graphics as part of their homework and so on. Yeah,
it's strange. Drawing is for children. Yeah. Very interesting. Can I ask a question, please?
Okay.
Will, I noted that you said that one of the things you had to do was select which article you did an abstract for when you. And I also noticed when looking at the work you do that there seem to be certain recurring patterns amongst what it is you do. I mean, tables feature a lot, and you have flow diagrams and networks and things. And it made me wonder whether or not there might be some sort of AI device that, as it were, articles could be tipped into that might, as it were, automatically generate a set of options that you could then select. Because of these recurring, often statistics are always there, numbers of patients, levels of this, that, and the other. I just wonder whether there might be scope for some sort of robotic designer that could generate options out of your selection of articles, which then I probably would need some human intervention afterwards, but could make suggestions, as it were, to what kind of graphics might be used to represent what's in the content of the article. Just a thought you might want to think about, answer to.
Yeah, that's a really good suggestion. I think you're right. Some of the best AI-based design work is something that has had it run through and produced some selections, and then someone has kind of curated those at the end and seen what comes out of it. The stuff that I've seen so far has been quite artistic and, you know, beautiful and interesting and useful, but I haven't seen a system that just works based on an article and then would spit out something that would organize that information visually. But it would be great if we could. I mean, and I don't see there's any reason why we shouldn't, really. I mean, like you say, there are a lot of common patterns in what I do, and I do find myself drawing another flow diagram or doing another table, or a table with this little extra feature or something like that, added to some illustrations and some text. So yeah, I mean, one thing that we're looking at is making those visual abstracts rather than an AI way of doing it, but can you do it based on a form? So you submit your information in a particular format and you submit an illustration, and then it will do the layout for you, which is kind of where we are with our rapid recommendations graphics now. They just send me a JSON file with the things in it, and I just drop that into a document, and it makes a graphic. And that's, I don't need to do much to that apart from do a little intro graphic to make it, something that's a bit more engaging, I suppose. So, that's kind of automatic production is something that we're doing more of. Whether it needs to be AI at this stage, I'm not quite sure, but there's a great idea.
You mentioned yourself at the beginning, there are actually, when it boils down to it, a relatively few like visual variables are available to you, and you can make things bigger and smaller to show size, and you can connect things with lines, and the lines can vary in size depending on values and so forth. So you've got color coding, you mentioned 2 gradients and things. You've got a small kind of subset of things, and I thought it might well be, hence I asked the question, amenable to that kind of AI approach. I don't know. Well,
it is to a certain extent, although in my PhD, I think I've got a list of maybe 30 or 40 different elements that you can assign information to. And then each variable that you're looking at can be assigned to one of them. So when you factor the 2 together, that's an awful lot of combinations. That you're having to make a choice over. I think there's still a lot of creativity behind the way that
you say 30 information types? Did you say 30 information types?
Sorry, 30 visual elements that can have information assigned to them, or they can be assigned to information. I don't know which way around you look at it, really. I mean, yeah, obviously the all obvious ones, color and shape and position, but the position can be in multiple dimensions, and then size can be in multiple dimensions. And then there's things like enclosing, linking. There's actually quite a lot of different ways that you can do it.
Well, I think I ought to read your thesis.
Certainly that section of it. I wouldn't even recommend reading the whole thing, but chapter 4, the first section.
4, okay.
I'll send you a link, Clive.
I'd better send you a draft chapter that's holding up a certain book, which you will feature in the near future.
About to plug his amazing data viz sort of taxonomy. I want to move on to a couple more questions.
I wasn't going to, and I'm not going to.
Okay, so Stuart asks, have you ever thought about, or have you ever deployed one of those interactive visuals as an app so that people have it more directly in their hand? I suppose you're addressing doctors rather than general public, but even so.
Oh, doctors use their phones an awful lot, particularly now in this age of information, and you can't store everything in your head, and hospital systems are terrible. So yeah, they're on their phones all the time checking things on our website and others. So I haven't done any specific app development of infographics or interactive graphics as it stands. I would like to get into that, and there's a lot of other things that I'd like to do, like VR graphics would be great as well. So yeah, there are ways we can do that we could. I don't even do that much in terms of the 3D modeling, let alone VR. There is one designer who works at our point of care tool, which is called Best Practice, which is a bit more kind of which is another product that we have as well as our journals, which is something that actually people are supposed to refer to at the bedside, and it is updated. Whereas the journal is more of a kind of here's a new piece of information to add to the mix, rather than something that you should refer to and that is constantly updated. So I think they might do a bit more of that. And they do have someone who does some 3D modeling work, which is quite useful sometimes.
Jorge is asking, is there any attempt in the BMJ to represent the level of evidence? I did notice one of your visual abstracts, there was a star rating, wasn't there, for quality of evidence?
Yeah, and that's something we put in our rapid recommendations as well. There's almost every outcome has its own level of evidence star rating. Yeah, the star ratings we've used in a few different places. There are other ways as well. Obviously, the main techniques developed for presenting medical research, like forest plots, which are just like a box with an error bar. Sorry, not a box, a little circle with an error bar attached to it, is the classic way of presenting uncertainty in medical circles, where you're saying the real value is we're 95% sure that it's in this range, and if that's, you know, that entire range is something good, then you're pretty happy. If it kind of crosses the line of, well, it might be good, it might be bad, then that's not, you know, taken to be good enough evidence to start using something in everyday life. So yeah, there's those two ways of representing uncertainty. I mean, this is a whole topic in itself. There's a David Spiegelhalter wrote a paper about visualizing uncertainty in science, which is something that I refer to a lot, and there's lots of ways of doing it in that as well.
That cover your question, Jorge?
Yeah. Well, my what I was thinking is that it has come to me from medical people trying to think, how do we represent the level of trust? Because in analyzing the performance of a drug, there's always, it depends. Huh? Let's say, like sometimes the evidence has come from a population that does not include people with diabetes, for instance. And so you cannot be too general. You have not only to talk about the quality of the evidence, but also the context within which that evidence is valid. And I was wondering if, because you deal so much with all this milieu all the time, if they have a right to some kind of agreement in the medical establishment about the way in which these things can be visualized, expressed, let's say, through some kind of visual strategy or not.
Certainly not a consensus, I would say. There's a lot of different ways of doing it. I mean, like I say, the classic error bars are the way of doing that. And then obviously you would look at subgroups like that. So you might have a forest plot with 10 different points on it, and each point will show you a different subgroup. So you'd say, these are the people aged over 50, these are the people, you know, with diabetes. So you do your subgroup analysis that way. But it's very mixed, the way that people present evidence, and you know, maybe I'm not helping with that, actually. Maybe I'm just coming in and trying to find other new ways of doing that.
No,
but,
I imagine that maybe within the BMJ, because it's a self-contained universe, there could be inside there some agreements, but sometimes medical professions in a country can agree on something. I haven't found that out. But I have another question related to a comment that you made about your thesis and the number of visual variables that can be used in order to indicate values or kinds. And I was wondering whether you have dealt with the context of human cognition capacity, because sometimes what I have seen in data visualization is because the computers can do so much, it is done. But then by the time you come to try to understand what happens, it becomes very difficult to carry in your memory, in your working memory, all the things that you're supposed to be looking at. How do you deal with that, let's say, balance between the possibilities from the point of view of what can be shown and the possibilities from the point of view of what can be understood?
Oh, that's a really good point. Yeah, just because it can be done doesn't mean it should be done. Yeah, that is really, and I guess we all have different abilities and different ways of learning and different ways of understanding things. And some people actually like to see things in a big table. And in some applications that is right. And sometimes, yeah, having fewer dimensions means that the dimensions that are there are clearer. I guess the gold standard way would be to test it with your audience and see, you know, can you understand this? And if not, why not? But yeah, we don't have the resource for that most of the time. So most of the time it's just done on a you know, a heuristic basis where you're talking about, I think that this will be helpful to these people because it helped me understand it, and show it to maybe a couple of colleagues. Or, you know, every graphic goes obviously through an editor at least, and a technical editor, and obviously it's cleared with the authors, so it's kind of a discussion, and sometimes the rest of the multimedia team as well, so it's kind of a discussion.
Okay, thank you.
It's not the ideal way of doing it, but it's the way we have to.
Let's move on.
Isn't that on that topic though? Isn't it? Or isn't it the old answer? Well, it all depends, doesn't it? I mean, sometimes you want a graphic where you want to get the message over in an inkling, you know, in a flash. You know, quickly say something is this way, and then there are other cases, and I would have presumed in the BMJ and the target for your people, there are things which actually need some very careful, hard thinking and studying and working their way through to extract what it is they get from your graphic. So you've got different audiences with different purposes. Isn't that the case?
Yeah, absolutely. And there's another thing, which is that sometimes the message that you're trying to convey is that a subject is extremely complex. And I don't know quite how I feel about it, but we have occasionally done graphics which I think are overwhelming and too complex, and they've done really well. And I'm kind of, they've been widely shared and people sort of talk about them a lot and like them, but I don't think they're that useful. But perhaps they're more of a rhetorical point, saying there's one I think about neurocognitive defects and potential medications, and there were hundreds and hundreds of them laid out around this big diagram of a brain. And I don't think it was that useful, but it does show how complex it is, and makes a kind of an argument. And then I meant that the cognitive scientists or the neurologists could share this with people and say, look how complicated is the thing that I do. Maybe that's what they were doing. I don't know how I feel about it. I don't do them too often. I try not to anyway.
Thanks. Let's move on to a couple more questions before we close, just to cover everybody's questions. Adam has asked about, you mentioned he says you mentioned wanting to improve the accessibility of the interactive graphics. Could you walk us through how people might struggle? So what is your problem? Are you worried about the usual accessibility things to do with perhaps color blindness or dyslexia or other well, even partial sight, or is there something more to it than that? That's quite
I mean, I guess we all have our own different ranges of ability, and vision is no exception. Again, it's different audiences and different capabilities. Some people will be able to see very clearly, and some people, and it's a sort of sliding scale, and it's trying to, I guess, get as many people able to use the content as possible, but also, I suppose, not to replace text. I like quite often editors tell me, well, this is covered in the graphic, so should we take it out of the article? And I always say no, because people want things in different ways, in different formats at different times. One disability might be like, I've got a toddler, sometimes I might be carrying her around, so I've only got one hand. I can't use both at that time, and that's a temporary disability. Or I might be, in a loud place like a train, so sort of audio stuff is a bit difficult or something, but visual stuff is easier. So I suppose it's just a matter of trying to do as much as we can to bridge that gap. I'd love to do more with screen readers so that people can at least have a good audio description of what's in a graphic. I don't think we're very good at doing that yet, and I think it's a kind of a writing skill, which is something that I'm not actually that good at. Sort of describing a graphic in words. They are all the interactive graphics are. They have actual text in them so that they can be found by a screen reader, but it's probably all disjointed and weird when you try and do it. And static graphics are just images, which is hopeless. So we do publish PDF versions, which are a bit better, but not so much. And like I say, using the keyboard as well, we try and make our graphics keyboard accessible in case of dexterity issues. But yeah, it's a real interesting balance between, should we make more graphics for people who do like graphics? Or should we spend less time making graphics that are accessible by more people? And there isn't really a right answer to that, is there?
I think it's an issue we always talk about in the summer school, and it's information design's hidden problem, that accessibility always means larger type and fewer colors and so forth. And all the tools which we need to visualize things turn out to be problems for accessibility. And yet we're a profession who want, we want to be usable by everybody all the time. It's a massive dilemma. Sort of move on to Petra's question. If I've got this right, Petra, perhaps just jump in if I haven't. But Petra, I think, is asking about how different sciences perhaps have ways of visualizing things already, but you're imposing, I suppose, your BMJ style on it, and they have to presumably relax about the way they know. Is that what I mean? What do you mean, Petra? Do you want to come in and express it yourself?
Yeah, I think sometimes scientists, they have their own special codes, how they do documents and how they visualize things, and they don't want it to visualize differently.
Yeah, some of the most challenging projects I've had has been where a scientist or an author has come and presented a graphic that they think should accompany their paper, and I have to try and persuade them to do it a slightly different way. That is always trickier than someone who comes with just a paper and saying, can you help me visualize this? I don't really know what to do. Then that tends to be much easier. So yeah, there are preconceived ideas, and sometimes it's just a process of listening and working out why it is that what I think is going to work, why they think that theirs is going to work differently, and come to some kind of compromise. And authors are normally really, really nice to work with, actually, and do kind of really appreciate having a different perspective on that. It's very, very rare that I come across a scientist who is very fixed in their ideas about how something should be presented. It is challenging when that happens, and we normally manage to make some kind of compromise. But I think there's maybe 1 or 2 projects I've had to step back from because I didn't think that, there was going to be a useful relationship. But that's over 8 years, and I've done probably hundreds of graphics over that time.
Could it be to do with the level of precision that they expect? Your graphics they're looking precise because they're bold, and they may be wanting more precision. Yeah,
there was a certain, when I was, again, but going back to the PhD work I was doing, and I would present some graphics to the team, and they looked really nice and had lovely colors, and they almost didn't trust them because they thought they had been made by a pharma company or something, because the things that they trusted were the ones that were done by their friends who were scientists, and they looked really like kind of, I thought they looked really rubbish, but to them they kind of were more trusted. It was interesting.
Yeah. Lisa has just commented on the previous discussion. I think that creating descriptions for graphics might be one of the next up and coming areas for development in data visualization. That is for screen readers. So having a better, and maybe it's one of these things that AI might be useful for as well.
Yeah, I have heard that current of discussion, and it is a really interesting one. Yeah. I'll keep my eyes on that, see if there's some good ways, good recommendations for how to do it. We should start doing more of it as well. Yeah. Okay, look, we're coming up to the hour. In the next couple of minutes, just wanted to check for any further questions. Anybody want to pitch in with a discussion? Well, look, it's been fantastic, Will. You're getting some very nice comments in chat, which you probably haven't had a chance to catch up with. But that was a really brilliant presentation, and I just one of the things I think I feel about these conversations is a lot of us as information designers are quite isolated. We may be the only person in our organization who don't. I mean, you're doing all that amazing work, and it's just you and a couple of freelancers for the whole of the BMJ. But you're making, I would have thought, a massive impact on it, and that's true of a lot of us, I think. And so that the more we can get together and share experiences. I mean, I'd almost like to, I could talk forever just on your experiences of actually working with teams and working with the medics and the authors and the editors and the struggles you may or may not have there. But if it was a struggle, it's not showing in the work, which is just looking absolutely fantastic. So look, thank you so much for sharing this. Thanks everybody for joining us. Thank you for having me.
No, it's been brilliant. And we didn't notice the lack of internet at all. So your provider is forgiven.
Can we do the old-fashioned thing? I don't like these little...
Can you do clapping? Okay. Except we're all muted. So yeah.
Oh, are we? Oh.
Yeah, we have to do jazz hands. Yeah. Yeah. Which is the approved way.
Thank you for your questions. They were really, really, really interesting and thoughtful. I'll think about the results of that.
Great, and this has been recorded, and we'll put the recording up on Triple ID. There'll certainly be a link from the Triple ID website, the Perspectives website, quite soon. And I don't know whether we've got it yet. We're starting a Triple ID YouTube channel for these talks, and we'll put the ones from earlier in the summer up there as well. And these will just become a resource for sharing information and experiences for students and designers. Okay, well, let's call a halt. Thank you so much, Will. Thanks everybody for joining us. And remember, 3rd of November for Carlos Rosa. And I'll send emails to everybody with when we get it. Thanks, everyone. Bye.
Thanks, everyone. Speak soon. Bye.